Hi friends, I brought in a video for you. This video is going to be on Nassa. Nassa has 15 milligrams of mirtazapine in it. It's made by Genetics Pharmaceuticals. The price for one box is 379 rupees. It has 20 tablets in it. Mirtazapine is an antidepressant medicine. It's used to treat depression and sometimes obsessive compulsive disorder and anxiety. It works by increasing the amount of mood enhancing chemicals called noradrenaline and serotonin in your brain. Mirtazapine is only available on prescription. It comes as a tablet and tablets that dissolve in your mouth or as a liquid that you can swallow. Mirtazapine usually takes 4 to 6 weeks to work. Common side effects include headache, dry mouth and feeling sick. They are usually mild and go away after a couple of weeks. If you and your doctor decide to take you off mirtazapine, your doctor will probably recommend reducing your dose gradually to help prevent extra side effects. Mirtazapine is not a sleeping pill, but it can make you feel sleepy. This can be helpful if you have depression and difficulties getting to sleep. The usual dosage for mirtazapine is 15 milligrams to 30 milligrams a day. This can be increased up to 45 milligrams a day. Your doctor may recommend dividing your daily dosage into two different sizes. If you have problems with your liver or kidneys, your doctor might prescribe a lower dose. You can take mirtazapine with or without food. Swallow the tablets whole with a drink of water. Do not break, crush or chew them. You'll usually take mirtazapine once a day. It's best to take it before bed so you can feel sleepy and you can go to bed and take rest. If your doctor tells you to take it twice a day, take the smaller dose in the morning and the higher dose before you go to bed. Once you're feeling better, you're likely to keep taking mirtazapine for several more months. Most doctors recommend that you take antidepressants for 6 months to an year after you no longer feel depressed. Stopping your medication too soon can make depression come back. If you forgot to take a dose, if you take mirtazapine once a day and miss a dose, skip the missed dose and take the next dose at the usual time. Do not take a double dose to make up for a forgotten one. If you take mirtazapine twice a day and forgot your morning dose, take it together with your evening dose. Your evening dose, if you forgot your evening dose, do not take it with the next morning dose. Instead, skip the missed dose and then continue the next day with your usual morning and evening doses. If you skip both doses, skip the missed dose and continue the next day with your usual morning and evening doses. Do not take an extra dose to make up for a missed one. If you forget usually and you can't remember to take your medicine, it may help you to set an alarm to remind you. You could ask your pharmacist for advice on other ways to help you remember to take your medicine. If you take too much, taking more than your prescribed dose of mirtazapine can cause problems. You may get symptoms including feeling sleepy, a fast or irregular heartbeat, feeling confused or faint. The amount of mirtazapine that can lead to an overdose varies from person to person. Some side effects of mirtazapine, like all medicines, mirtazapine can cause side effects in some people, but maybe many people have no side effects or only minor ones. Some of the common side effects of mirtazapine will gradually improve as your body gets used to it. These side effects of mirtazapine happen in more than 1 in 100 people. There are things you can do to cope with them. The side effects are dry mouth, increased appetite and weight gain, headaches, feeling sleepy, feeling or being sick, nausea or vomiting, diarrhea, constipation. So if you have a dry mouth, you could increase the consumption of water. If you have an increased appetite and weight gain, you could increase the amount of exercise you give your body every day. If you have headaches, you can try some soothing oils. You can apply some soothing oils to your body which can calm you down, which can reduce the headache. You can, if you're feeling sleepy, try to take the dose in the night before going to bed instead of taking it in the morning. And if you're feeling sick, nausea or vomiting, you could use another medication to treat those symptoms, and speak to your doctor or pharmacist if you need advice on how to cope and if it doesn't help and a side effect is still bothering you or does not go away. There are some serious side effects of mirtazapine. If you experience severe pain in your stomach or back and nausea, or if you have constant headaches, long lasting confusion or weakness, a frequent muscle spasm, or if the whites of your eyes have turned yellow or your skin turns yellow, and although sometimes it might turn brown or black, these are serious side effects. You should consult with your doctor immediately if you have them. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.